Have you ever heard of hormone therapy and thought it's unsafe? Or do you hear negative things about hormone replacement therapy or HRT? Is it true? That's what we're going to discuss today. Some major myths.
Yeah. Are they true? Are they not true?
Yeah.
Busting some myths.
Busting. Welcome to RMD Podcast Channel with me, your host, Dr. Deborah Durst, and Farideh, my co-host.
Hey guys, Farideh Golan-Bieski, family nurse practitioner at Revitalize MD. And this is going to be a fun podcast.
Mythbusters.
Do you guys remember that show? We were just talking about it before the podcast where they'd come across myth busted.
Yes.
So that's what we're going to do. We're going to bust some myths today.
Have you ever heard of hormone therapy and thought it's unsafe? Or have you ever, or do you hear negative things about hormone replacement therapy or HRT? So is it true? That's what we're going to discuss today. Some major myths.
Yeah. Are they true? Are they not true?
Yeah.
Busting some myths.
Busting. All right. So basically, the first one, does HRT cause cancer?
I think that's probably the biggest
Correct.
question, right? The hottest topic when it comes to hormone replacement therapy.
Yeah. I think across the board, again, there are a lot of studies that support hormone replacement therapy and actually being cancer protective in certain cases. But in this one, we're going to talk specifically about breast cancer and that massively increased risk. So it doesn't cause breast cancer, but it can cause it to grow if it's there. But what are we looking at that caused? What was the root cause of the breast cancer increased risk? And it was the WHI, right? Yeah. So the WHI started in the 90s. It was prematurely ended in 2002 because of a 25% risk of breast cancer.
So Dr. Durst is going to break that down for us and what that means and where that number actually plays into everyday statistics that we see.
So the WHI, Women's Health Initiative, it's a huge study. We're only going to address this one little piece of it today because that's about 10 videos in and of itself. Let's just say that it was synthetic hormones that were used, and one of them was using a combination of estrogen and progestin. And with that arm of the study, there was actually a baseline rate of breast cancer in the placebo group of 4 in 1,000. And in the dual treated or progestin, synthetic again, and an estrogen product, which was Premarin, there was a 5 in 1,000. So that was reported on all the news agencies of a 25% increase. So that's a relative risk, right? But look at that absolute risk. You're talking about 4 in 1,000 increase to 5 in 1,000, which is 1 in 1,000. That's with synthetic hormones. So that's not a 25%. So you have a risk of 1 in 1,000 if you're potentially on hormones. But let's look. That's synthetic hormones. We're talking about bioidentical hormones. And the studies with bioidentical do not show those same results. But it was also the progestin of the synthetic for those because the arm with just the synthetic estrogen didn't do it. So the bottom line is it was a media hype. It has taken women off hormones since 2002. And we still are not adequately treating women because of it. So it is.
And with the stop of hormones in the early 2000s, did breast cancer go down?
No, actually, breast cancer has continued to rise over time. So it has not went down, but hormone replacement therapy was almost nothing for years, but it's definitely
scary.
Minimal.
It was a scary study that came out. And what happened? Physicians pulled patients off of hormones. Women were scared to be on hormones, so it slowed down. But did incident rate slow down?
No.
Yeah.
So clearly, just logic would tell you there's something else at play here. But physicians are still afraid of hormones and still don't understand them, and neither do patients. So we have really minimized the use of hormones in women and have done them a disservice. But likewise, the breast cancer risk or breast cancer incident has not decreased. So that should tell you something. So that is a myth busted.
Ish, right? Because there is a risk.
Well, I think there's
with hormones of breast cancer growing if present.
So it doesn't
but
cause,
doesn't create it and cause
yeah,
it.
it doesn't cause breast cancer. And it's definitely a myth for this big, bad, thing that causes all kinds of cancer and a huge risk. And I think that JAMA, there was actually an editorial piece, an opinion piece that recently came out with an even higher than 25%, I want to say 50% increase risk of breast cancer with no numbers to support that. So it definitely is not true that it causes the numbers that we have been reported as fearful, over time. So it is going to somebody that knows those numbers, knows hormones, and can
And knows what
advocate.
was used for those numbers. So I think what really is important is the form of hormone replacement being used, right? The synthetic versus a bioidentical or natural hormone. And then also your own individual risk factors.
And
Your
screening.
health history plays a big role on if you're a candidate for hormones or if hormones are safe for you.
Correct. And screening over time if you're on it. Because again, if it doesn't cause it, but can cause it to grow, you need to follow that.
So mammograms.
Yeah. And I don't think you can be on the fence busted or not busted, I think. So we'll just need
does
to
it
make
cause
it
it?
bigger. Yeah.
No, it's busted.
It's busted. So, all right. So HRT, that's the second one. It's only there, hormone replacement therapy, only there to treat men that have erection issues or low T and sex drive issues, or women that are postmenopausal. Those
And
are the
that's
only
it.
two things.
Is that true?
So we'll just go into, again, we treat both men and women and on a daily basis. And they're not all in menopause.
They are not.
And the men don't all have just erection and libido issues.
That's it. So testosterone decline in men causes more than just erectile dysfunction. We have men that come in and are treated on testosterone that do not have erectile dysfunction. That is not why they're there. They're there because their energy is down. They have brain fog. They're having weight gain. They don't feel like themselves. They're losing confidence. They have more anxiety all of a sudden. They're having joint pain. All these things are happening and they don't understand why it's happening. And it's not necessarily because I'm here because I have erectile dysfunction or my libido is low. It can be a combination of things. Now, does low testosterone lead to low libido and erectile dysfunction? Yes, but that's not the only reason why we're seeing patients.
And for men and women, a low T, if a man, like again, sex drive is the last thing to go with men and the first thing to go with women. And so again, it's not as if a man can come in with a very low testosterone and still have a sex drive. So it's innate, and that's experience. That we're telling you that we see that on a daily basis, and yet for women, it seems to be like one of the first things that go.
Yeah.
So
testosterone is for more than just men. And hormone replacement is for more than just postmenopausal and menopausal women. We see perimenopausal women.
And actually very young now. Like we see women coming in younger and younger, it seems. So
And that doesn't mean they need all the hormones.
no,
right?
but they have some symptoms that they want evaluated. They want their hormones looked at. And sometimes there may be a cause for that we discover. But it clearly isn't just in postmenopausal. And so, again, those same symptoms that we treat for men, they could come in with sleep issues, depression, anxiety, weight gain, body composition changes. It could be
Brain
low
fog.
sex drive, decreased orgasmic strength, brain fog. We could go on joint aches and pains, energy. So, all of those things don't just happen in a postmenopausal woman.
Or a low testosterone male.
Yeah.
They happen across the board.
So, is this myth busted?
Busted.
That one clearly busted. So that one's an easy one. So again, is HRT. So the third myth that we're going to talk about is HRT or hormone replacement therapy, hormones, whatever you want to call it. Is it unsafe and unnatural?
And this one we've done podcasts on this. So if this is something you are really interested in, please check out our podcast on natural versus synthetic hormones because that kind of ties back to this. So when we're talking about hormones being harmful and unsafe, well, we were born with them.
Yes. Well, it
They're
actually
an innate
would.
part of us.
So if you really want to go down that route, we could go back to, does testosterone and hormones cause cancer? Because if it did, a patient or a man that was really young with a high test would have prostate cancer, and a woman in her pregnancy would have breast cancer. So again, just them causing it and it's bioidentical we're using already tells you logically that's not the case. There's something else at play. But again,
There are lots of
natural.
options for bioidentical and natural hormones that reduce that risk.
Correct. So basically, the unnatural is not the case because you're right. We were born with
them.
it. And what we're using is bioidentical hormones that are identical to the body.
That come from a natural source.
Yes. So definitely not unnatural. And as far as unsafe, not unsafe because they are identical to the body. And so when they say unsafe, they're really kind of questioning, again, the sources, meaning these compounding pharmacies have deemed to be very unsafe pharmacies, but really, again, highly regulated. In our other videos, we talk about this. Highly regulated. They're FDA regulated. They're also state regulated. They are independently, inspected. They have to prove formulas. They are independently, third-party tested. So they are safe. And we see that in practice every day where we are doing blood levels so we can see if they're responsive. And so the safety concerns, because it's a compounded pharmaceutical agent, is not an issue. So,
No, but I do think it's important to note using accredited pharmacies.
Correct.
So not all pharmacies are created equal across the board.
Yes. And I agree. And we've done another video that talks about that more in depth. So this is a myth busted for sure.
Absolutely.
And
we know that they are natural to us and we can replace them in a natural form or a bioidentical form. And the safety profile for hormones we've discussed as well. They are safe, but your individual health history does play a role in that, and they are not always for everybody.
correct. So the next one we're going to say is, again, our hormones, or I should just say our menopause symptoms treated just with estrogen. That's actually probably a more specific than that.
Yeah.
Is estrogen
So the original
only
was
one?
does HRT or hormone replacement only address menopausal symptoms, but specifically what they were getting at in this myth this question that came up is the only way to treat menopause is with estrogen.
Because again, that is a frequent thing that we see in practice. So a patient goes to their primary care doctor or their OBGYN. Sometimes all hot flashes equal estrogen loss. And so without even testing, they're placed on estrogen. Or they're tested, they're menopausal, or they're clearly just menopausal, not tested. And estrogen is started, but not other hormones such as testosterone or progesterone.
And they still have symptoms.
Yes. So the bottom line is menopause doesn't equal just an estrogen decline. Yes, it is estrogen that officially is not being produced anymore in menopause.
That is really the
transition.
That's it. That's the transition. Once your estrogen goes less than 5 and your ovaries stop producing the hormones that are for you to ovulate, that's how we know we are 100% in menopause. But there are multiple forms of hormones that we treat.
Yes. And again, that perimenopause leading up to it, we'll do a whole nother podcast on that. But the bottom line is the transition from perimenopause to menopause is a stop or your estrogen is no longer being produced. But it doesn't mean that's the only thing that needs to be replaced. So that is a myth. And otherwise, we'd already addressed the other, that it's not just menopausal symptoms because we use it for other things. Yeah. So then again, some of the studies that would support at least those big myths. Well, the other myth is also, are hormones in women just used to treat symptoms? That's a great one.
That's a great one.
Mm-hmm. So is it just symptom control that we're doing?
No, it is not.
No.
It does help symptoms, and that's why patients come back. I mean, that's why I can, that would be the initial reason, right? If you're having hot flashes and night sweats and you're not sleeping and you're moody and all these things and all those symptoms go away and you're back to yourself, that's a reason to come back, but that's not the only reason.
Correct.
There are some health benefits.
Prevention. So we talk brain, bone, and heart. So those are the three big organs that you are protecting with hormone optimization. So we think about it, we age, all hormones decline, inflammation in the body starts, and that's when all diseases start. So brain diseases, memory, dementia, Alzheimer's, bone, osteoporosis, osteopenia, leading
Increased
up
risk
to
of
it.
breaks.
Yeah, so you're going to have some fractures that happen. And then we're talking about cardiovascular risk. So it's a cardiovascular protection that is offered too. So there's preventative in addition to symptom control. And so those are the two big things that we like to discuss with all of our patients, because even though your symptoms are going to get better, this is also a preventative treatment that we're doing. And so we're optimizing for prevention. So
Yeah. I had a patient come in not that long ago that said, my primary was so excited. My DEXA scan has improved. She told me,
yes,
whatever you're doing at that clinic, keep doing it because this is the first time I've seen it improve. And
correct.
it's replacing testosterone, estrogen, and progesterone.
Correct. So that brings me to another myth we didn't even really have listed as one is so again, what are the only treatments for osteoporosis? Medications.
No.
No. So, and again,
No.
it's not just women in bones. We all have bones.
We
So
all
for
have
men,
bones.
so for men too. So if we think as we get older, we, look weaker, our posture is different. Those are,
you're
muscles
gonna
that
make
are
me sit up
supporting
straight
your
now.
spine. Yeah. So basically, the only thing that is going to really strengthen bone is hormones and vitamin D. And so it's not just medications. And that's not the first one because, again, one of my patients specifically came in because she didn't want to take medications for osteopenia and her DEXA scan that was negative or that was bad. And that, like, again, they were, and it was an indication for her to have some medication related to that, and she didn't want to take it. So that was the reason she came to us, and her DEXA scan is positive too. So again, eventually even having those DEXA scans to look at, because we do in-body composition, but it doesn't really look at the bone as well as a DEXA scan would. So it'd be nice to follow the fact that, women that are hormonally optimized actually have good bone density.
That's it. And I love when those conversations come up because I can say, remember when I told you?
I know.
It helps improve bone health. And you're like, yeah. I just want these hot flashes to stop.
Right? Yeah.
Well, now you're also less likely to break a hip. So
yes, yeah. And so that is a huge, so that's a myth. It's not just medication. So if we looked at just some studies to support what we were talking about as far as breast cancer, that WHI way overstated the risk, and it is not that. And so you need to know the facts, and you need to have screening and see somebody that can follow that, but it is not the risk that they say, and it doesn't cause it. Or else, again, when your estrogen was highest, because these are bioidentical, that is when you would have the greatest risk of breast cancer, and that's not the case. So that is like what's supporting in the fact that it still continued to increase over time, but our hormone treatment for women has decreased over time, would just tell you that's not the case. Cardiovascular health, again, the lower risk reported even with the North America Menopause Society, but also even, panned out in the WHI study is that the early treatment with hormones has
cardiovascular
benefit and protection. And so when you look at the WHI and they were talking about increase, again, that's a whole nother video, but the bottom line is if you transitioned from peri to menopause, so you're younger when it happens, then there's cardiovascular protection. And then bone health.
And then bone. Now the WHI did have some good data on bone.
Yes. Yeah.
It did. It showed for spine and hip. Decreased breaks up to 23%.
And that was still synthetic. So just think about all the benefits that we can do. And of course, obviously, there's always going to be more studies that are needed for anything. I can see positive studies that are done all the time, and it's still always more studies that are recommended. But bioidentical, it's hard to find a lot of big studies on bioidentical. And when you do, it's really kind of a 5-year is good, and beyond that is unknown. And it's really just because it hasn't been studied adequately.
That's
and
it.
so,
and I feel like over the last, 5 to 10 years, really 5 years, bioidentical have really become more widespread. There's more information out there. There's more access to it. There's more patients on it. Hormones are not as taboo. It seems to be a little bit more of an open conversation with patients. So that is definitely needed. We need to stop looking at information from the 90s and the early 2000s in synthetics, and we need to be looking at bioidentical information. We need a bigger study, but because Big Pharma isn't behind it and the funding isn't there, we're just not seeing those studies, unfortunately. The studies tend to be smaller.
Yeah, because again, you cannot patent something identical. And so the hormones, big studies are supported with money, and who's supporting those studies. But I would say they're safe, they're effective. Those are the two big questions.
Yeah.
And are your symptoms controlled? So if they're safe and they're effective, and there might be some questionable risk here and there, like there's questionable risk with medications you're on.
I was going to say,
and there's
all medications have a risk related to them.
And there's no big studies really to support them when they come to market either. There's studies, but they are supported by pharmaceutical companies. So there's a bias there. And there are risks, including sometimes major morbidity and mortality with medications. And so if this is life-changing for men and women, and the risk
changes your quality of life and improves
changes your quality of life, and the risk is manageable, like manageable beyond belief, like because it is manageable.
We take synthetic hormones. We prescribe synthetic hormones, and people take them free willingly with a huge list of negative side effects, as you said.
Correct.
Right?
And
but
so
every day I have patients say, this has saved my life. This has changed my life.
This
has made such a huge, what you're doing, getting help, having someone to talk to, having someone listen to me, feeling better, feeling like myself again. I mean, these are all things that we hear on a daily basis.
All day long.
So when we're talking about medications and risks, all medications have risks. We're not going to sit here and say it's 100% safe to be on hormones. There are always risks related to any medication you take. But that risk versus that benefit and then your individual health all play a role on if this is right for you. And that's always a discussion between you and your physician.
It's called informed consent.
Exactly.
That's what that's called.
That's what that is. It's informed consent. I understand.
It's informed consent, and then let the patient decide from there. Go to a trustworthy provider. You are having discussions. You make an informed consent to do the treatment, including medications, and you probably don't nearly get the informed consent that we go through on a daily basis, and it's life-changing. Yep. So I think, again, safe, effective, informed consent, let them make the choice.
Yeah.
And so based on,
So are there any myths we didn't bust that you want to know about?
Yes. And so you just let us know, because we are willing to deep dive into anything wellness or sexual wellness.